by the Supreme Court of India to address the mental health concerns of students and to prevent student suicides in higher education institutions in India. I'm also joined today by Sakshi and Nirbhay, who are our sign language interpreters and who will be translating the proceedings of today's press meet. I am Dr. Aksar Sheikh, and I am a member of the National Task Force. We will now be having a round of introduction by all the members of the task force and the chairperson of the task force. So, may I first of all request the chairperson to kindly introduce himself to the press.
Good afternoon. I'm S. Ravindra Bhatt, a former Supreme Court judge, and I'm presently the chair of this task force. And I look forward to being with you for the next 1 hour or so. Thank you.
May I request the member secretary, sir, to please introduce himself?
I'm Vineet Joshi. I'm Secretary Department of Higher Education and Member Secretary of this task force. Thank you.
Thank you. Convener, madam, if you may introduce yourself, please. Reena, madam.
Good afternoon. I am Reena Sonowal. I'm convener of the task force.
Thank you. We also have the members of the task force on the dais. So may I request, maybe from right to left? Yes, madam.
I'm Dr. Anju Rana, Law Secretary, Ministry of Law and Justice, Department of Legal Affairs. I'm one of the ex officio member of the task force. Thank you.
Thank you so much, madam.
Good afternoon. My name is Aparna Bhatt. I'm a lawyer. I'm a member of the task force as well as the amicus curiae in the matter.
Hello, I'm Mary John, a retired professor of women's studies, and I'm also a member of the task force.
Good afternoon. Good afternoon. My name is Arman Ali. I'm a disability right advocate and a member of the task force.
Good afternoon, everyone. I'm Nidhi Sabarwal, and I'm National Fellow at the National Institute of Educational Planning and Administration, and I'm also a member of the task force. Welcome, everyone. Good afternoon. Dr. Seema Mehrotra here, Professor, Department of Clinical Psychology from National Institute of Mental Health and Neurosciences, HIMHANS, Bangalore, and a member of the task force. Welcome, everyone. Thank you.
Thank you all. And we also have some more members who unfortunately have not been able to join us today due to other commitments. And let me introduce them to you in absentia. So we have Dr. Alok Sareen, who is a consultant psychiatrist at Sitaram Bhartiya Institute of Science and Research, and he's also a member of the task force. Then we have Professor Raj Kachru, who is a social activist and also a member of the task force. Then we have Professor Virginius Khakha, who is a visiting professor in the Institute for Human Development and is also a member. In addition, we have five more ex officio members. We have Shri Govind Mohan, who is Secretary in the Ministry of Home Affairs. Shri Sanjay Kumar, Secretary, Department of School Education from Ministry of Education. We have Shri Amit Yadav, who is Secretary in the Department of Social Justice and Empowerment. And we have Shri Anil Malik, who is Secretary of the Ministry of Women and Child Development. And last but not the least, Ms. Punya Salila Srivastava, who is Secretary in the Ministry of Health and Family Welfare. I now request the chairperson to kindly provide his opening remarks.
The judgment of the Supreme Court of it was in the third week of March 2025, took up this issue of student suicide. The immediate trigger was a one suicide incident, but what troubled the court was that there is an increasing frequency in this the kind of episodes of suicide and suicide attempts by students in higher educational institutions. The country has witnessed many of these incidents. They have led to several uh, studies. Sorry, they have led to several studies being commissioned. Commissioning of several studies which gave out
Hello, 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 hello. ये क्या हो गया मैम? आउट कहाँ चले गए इसके?
so this
हेलो,
led to
हेलो, हेलो.
yeah this led to several committees and several study groups being commissioned. They have filed their reports. Their reports have been given to the institutions. Some corrective measures were taken. So now this national task force, many would wonder why one more study for one more task force. Why do you need yet one more group to go into this? I think the need is that we have to have an overall picture of what is happening among that uh, age group in the country as a whole and not focus on individual institutions. Individual institutions give a sample. So that's what perhaps impelled the court to say that you and put together this national group of very diverse people from very diverse disciplines. We have social activists, we have eminent sociologists, we have people from the clinical psychology, disability rights, women's rights. Then we have just Dr. Aksa Sheikh, who is an expert in community medicine, besides all of us. So the idea is to put together all of us in a multidisciplinary task force, study this phenomena in diverse manner. So we are going to uh, roll out a website and which has been developed that will be hosting questionnaires for different target groups, students, let's say survivors, maybe parents, teachers and faculty members of institutions, as well as administrators and policymakers. So these diverse questionnaires are meant to elicit responses. Besides, they can also come out with their own suggestions and responses. We intend to analyze this as part of our task. We also intend to visit, and this is purely as a sampler, and we can't even call it a representative sample. We have a large country with over 52,000 institutions. So we will be uh, trying to cover regionally and critical areas, not necessarily large cities, some large cities, but also we'll go to smaller places where there have been the history of more incidents and try to cover it. That is the second methodology. The third methodology which we are adopting is talking to and interacting with diverse stakeholders, policymakers, and those who have also interacted and worked in the field of suicide prevention and related work. And perhaps also talk to people who have written reports in the past so that we get enlightened. And with all these learnings, we will try to come out with our findings and submit it to the court. So your involvement here is important because we want the press to disseminate this information about this task force and also uh, make a greater awareness among the people and among the target audience so that we get the best responses and the clearest picture of what is happening in this field. Thank you.
Thank you, sir. May I now request the Secretary, sir, to please give his remarks.
Thank you very much, and a very good afternoon to all of you. Respected Chairperson of the Task Force, distinguished members of the Task Force, ex officio members of the Task Force, media persons, and everybody connected today, especially the nodal officers across the states. Uh, as the Chairperson has given the brief that this task force has been mandated by the Honorable Supreme Court of India, has been mandated with an important task of identifying the predominant causes which lead to commission of suicides, analysis of existing regulations, and recommending concrete steps. The task force has been working for last some months, and it has been discussing as to how do we move forward. Questionnaires have been prepared, which will be launched when the website is launched today. As far as the higher education department is concerned, uh, this is a nodal department for this task force, and the secretary of the higher education is the member secretary. As we are aware that there are more than 60,000 higher education institutions, and every institution has its own context. So therefore, identifying the causes and suggesting recommendations is going to be an extremely challenging task, and this task force is completely committed to that. And therefore, in that direction, this one more step which is happening today is the launch of the website to solicit the information as well as suggestions from every stakeholders. As we are aware that student suicide is a major concern for all of us, and these contribute about 7.6% of the total deaths which happen as per the NCRB data which is available with us. The task force, as a matter of its process, they will be they have been going to various institutions. They will also be going to the various institutions, and different methodologies will be used. One will be the questionnaire survey, another one will be the focus group discussions, then there will be expert discussions as to how to go about it, as well as different other study of reports which are already available with us as well as with other stakeholders in the country. And eventually the task force will give its report. As the part of this task force as member secretary, I would like to assure everybody who is connected today that this department is committed completely to ensure that not a single life is lost, and we create an environment in the country in which everybody, every student is able to come up to his or her own expectations. He or she is able to achieve his or her dreams. Thank you very much, sir, for guiding us, and I promise you all the support. Thank you.
Thank you so much, Dr. Joshi, sir. And as has been mentioned, I want to re-emphasize that the Ministry of Education is the nodal ministry, and in letter and in spirit, we are all working together along with so many other ministries who are involved in the process. Now, to understand the premise and the background of the task force, may I invite Professor Mary to the dais? If that's working.
Good afternoon to you all, and welcome to this important moment when we're about to launch a nationwide website which hopes to reach out to all students who are currently enrolled in higher educational institutions, of which, as you heard, we have almost 60,000. This is a historic moment in good and bad ways. On the one hand, we are seeing the extraordinary expansion of higher education in our country. The gross enrollment ratios have doubled in the last 20 years and stand at something like 28%. Moment where women are now almost at parity with men when it comes to averages in our higher education institutions. We are seeing diversity on many fronts in terms of reservations, in terms of community identity, Even the occasional student with disability is also now present in our higher education institutions. So on the one hand, there has been almost a democratization here. But on the other hand, we are seeing a very disturbing rise in the number of cases, which, as per it was mentioned, the NCRB data, which counts FIRs that are lodged in the police stations when suicide happens, they have crossed 13,000, which means they have crossed farmer suicides, which at one point was considered a crisis of agriculture. They have crossed the numbers of unemployed. So should we speak then of a crisis in higher education? This is what we are trying to address in our task force. It is, as it has been said, a major challenge, and one that we don't, even though we are called a task force that handles mental health, prevention of suicides, as per the judgment and as per our own understanding, we don't think of this as purely a mental problem. We do believe that there are multiple factors today that are at work. Imagine also that the FIRs are a tip of the iceberg. For every case that actually gets lodged in the police, there are many that never do. And think of the many who may be feeling distress, who may be on the verge and do not, but somehow survive. So we are up against a major task, and we see ourselves as having to, as a social issue, as a mental issue, as an issue where the police also has to play their part. And it is in this context that we are hoping to address it on multiple levels, which I think other speakers will now address. Thank you.
Thank you so much, Professor Mary. So, as we understand, the landscape of higher education institutions is changing, and we want a comprehensive report which is based on the views of the stakeholders. तो इसी कोशिश है कि जो विद्यार्थीगण हैं उनकी आवाज जो है उनकी बात किस तरह से हम इस रिपोर्ट में शामिल करें। तो अब मैं रिक्वेस्ट करूंगी श्री अरमान जी को कि वो बताएं कि किस तरह से उनके व्यूज जो हैं वो हम इस रिपोर्ट में सम्मिलित कर सकते हैं।
Thank you, Aksa. Good afternoon, everyone. As part of the task force, जैसा कि कहा गया, Honorable Chair also mentioned, we are using multiple ways to reach out to the stakeholders, particularly the student community and institutions. The task force has visited 6 institutions of prominence, about 4 of them in the Delhi NCR, about 2 in the south, in the state of Karnataka. And the first impression which comes to us that there are issues that we have seen from multi-dimensional point of view, not just infrastructure, but other issues which are there. And we have been interacting with the students, faculty, non-teaching members of these institutions of higher prominence in the education and academia, and also looking at the kind of infrastructure that they have in terms of teaching and recreational, in terms of support of if somebody is needing any kind of support for their mental health and so on and so forth. And I must be on behalf of honestly on behalf of the task force that there are definitely issues on all sides, whether it is from the point of view of the students in the of institution of higher education or the institutions themselves. And I believe when we have the interim report by the end of September, some of these reflections will definitely come forward. This is what I would like to share at this moment. Back to you, Aksa. Thank you so much.
थैंक यू अरमान। तो जैसे कि अरमान ने बताया कि इंस्टीट्यूशनल विजिट्स, उसके अलावा स्टेक होल्डर कंसल्टेशंस, इनके माध्यम से जो विचार हैं जितने भी स्टेक होल्डर्स के वो हम शामिल कर रहे हैं। लेकिन जैसे कि आपने सुना कि लगभग 4 से 5 करोड़ विद्यार्थी जो हैं वो उच्च शिक्षण में इस वक्त हैं, और उनके पेरेंट्स हैं, उनके टीचर्स हैं, तो एक बहुत बड़ी संख्या जो है उनके विचार हमें हासिल करने हैं। और इसके लिए आज नेशनल टास्क फोर्स अपनी वेबसाइट लॉन्च कर रहा है, उसके साथ में बहुत सारे सर्विस भी लॉन्च कर रहे हैं। तो इनके बारे में ज़्यादा जानकारी के लिए और इनके डेमोन्स्ट्रेशन के लिए मैं प्रोफेसर सीमा मेहरोत्रा को इनवाइट करती हूँ।
Good afternoon. I hope this is working. Am I audible? तो जैसे कि हमारे सब कलीग्स ने बताया, what we are trying to do is use a multi-method approach to gather information and perspectives from different stakeholders. So online surveys has been one of the approaches we have adopted. It is only one of the approaches, but nevertheless very important to reach out to a larger number of stakeholders. Through the surveys, the online surveys, we wish to receive inputs from students of all higher education institutes in India, not necessarily of one kind or another, but all kinds of institutes of higher education, parents of students in India, faculty members teaching in higher education institutes, as well as mental health service providers who may be providing services to students either within the campuses and universities or through their own hospitals, clinics, but they do serve the student community. So we are looking at all these groups of stakeholders when we are conducting or we are launching the online surveys, and we request their participation and support. Now, these surveys cover a very wide range of themes and aspects, which some of which I would just like to mention as to what is being captured through these surveys. So these include items pertaining to campus environment, the sense of inclusivity and belongingness that students experience within the campuses, perceived sources of support in campuses, nature of distress and difficulties or challenges that they experience, the student support services mechanisms that are at place in various institutes, as well as the suggestions these stakeholders may have as to what more can be done to strengthen student support mechanisms in higher education institutes. We have, in addition to the stakeholders I spoke to you about, that is students, parents, faculty, and mental health service providers, we have also designed a specific survey for institutes themselves, that is administrative heads of various institutes of higher education. This survey seeks factual data from the institutes as well as the observations and suggestions that the institutes may have on this matter of grave concern. It includes information and observations pertaining to various student committees and cells which may be operating to help students, the nature of complaints received, the kind of resolutions that have been possible, as well as the support services for students, including mental health services that are being offered, the uptake of these services, the challenges that institutes face in supporting students, as well as suggestions from the institutes regarding what more can be done and what kind of support institutes might need to fulfill this goal of strengthening student support and enhancing their well-being. It's very, very vital, I would like to say, on behalf of the task force, for us to receive information and perspectives from institutes. Timely and accurate information from the institutes would really go a long way in helping us achieve this task that we have been tasked with. So, in this connection, to facilitate responding to the surveys, we have launched, or we are launching right now, a website called ntf.education.gov.in. So here is the website. At, at first, we would like to place on record our sincere appreciation for Ministry of Education, Department of Higher Education, to facilitate this, and NIC, National Informatics Center, the team led by Shri Anwar Khan ji and his team, that is Kunal ji, Sapna ji, and Danish, for helping us come up with this website. We are really grateful to all of you, sir, and the NIC team. Thank you so much. So As you see, apart from providing information about the task force that you see on top, and also providing some helpline resources that are available, helpline numbers to the students who may reach the website, who may be in distress. The main purpose, the primary purpose, if we can go back to the home page, the primary purpose of this website is to gather information, gather perspectives of stakeholders. Please do note that the information being captured from students, faculty members, parents, and mental health service providers is completely anonymous. It is stored confidentially in a secure server with limited access to the task force itself in a secure government cloud. So now let's look at how does this website function. Example, hypothetically, if you're a student, you click on the student survey, click take this survey, the button, go on to receive some basic information because you are providing information with your consent. So there is a consent form. Then you go down. Can we scroll down, sir? It is available both in English and Hindi. When the participant or the user confirms that they are voluntarily taking part, then you have a captcha that you fill in, and then you move on to start the survey. And that's a process being followed for all stakeholders except the institutes, about which I'll cover later. So when you start the new survey form, then you can go on to fill, and we request you to try and fill this form at one go. But I know the student form is pretty lengthy because we expect it to be very comprehensive in covering various dimensions. So those students who wish to take it later, they can have a random number generated once they fill one section, and they can resume the survey using the resume survey or continue with the survey button later on. So that's about students as well as other surveys which are similar. Now so you need to note down the random number that gets generated because we are not capturing any personally identifying information. We need to note the random number and then go back on top to get to the section which was left out. When we come to the institute, we request institute, we will be sending information to institutes through email as well as through other means, and we encourage our state nodal officers also to widely circulate this information within the respective states. I'm sure our state nodal officers are online. So what do institutes do? They go click on the institute survey, then they reach a login page. Please remember that this is a login page for institute. So they need to log in using HEIs credentials. Institutes fill in information on an annual basis for annual surveys that are conducted by the ministry. So using HEIs login credentials, they can fill in the CAPTCHA and then go on to responding to the survey items, which include both factual data about the institutes as well as perspectives and suggestions that they can speak about. Then we have express your views, that is an open space, which is meant to capture voices of those stakeholders which are not covered via any of these surveys. Who can take your survey? For example, someone affected by a student suicide, maybe a friend, a family member, an alumnus of a higher education institute, a mental health advocate, a media professional, or concerned citizen from any corner of the country. So we request those who respond to identify themselves by mentioning the group to which they belong rather than providing personally identifying information in this open space, and then use the open space to express their views, observations, experiences, as well as offer suggestions that could be considered in the process of our work. So, um, these are some of the key elements of the task force website. Thank you, Kunalji, for showing us that. We can get back to, yeah. So, to conclude, I would just like to mention to all of us here, offline as well as online, the task force urgently and earnestly requests each of the stakeholders as well as the state nodal officers to contribute to this work. We cannot do this work alone. We need your support. We need your voices. We need to hear. We need to process. So we request you to contribute to our ongoing work by responding in large numbers to help us gather diverse perspectives which will enrich our understanding of this landscape and to shape the recommendations that we provide to the Honorable Supreme Court. Thank you so much.
Thank you so much, Professor Seema. So, as Professor Seema has mentioned, the work in terms of website is completed and the website is launched. It is live. And we again request all of you, all the stakeholders, to provide us with the useful views and suggestions that will only make our recommendation stronger. We now go to the open forum, and I request the media friends who are present here to ask any questions that they may have. You are also requested to please identify yourself, the institution, and your name so that it is easier for us.
चंद्रशेखर है मैं दूरदर्शन डीडी न्यूज में हूँ मैं जानना चाह रहा था कि थोड़ा
थोड़ा सा
हेलो
तेज बोलना पड़ेगा और
सर
स्लो बिकॉज आवर
मेरा नाम चंद्रशेखर है मैं डीडी न्यूज में सीनियर कॉरेस्पोंडेंट हूँ मैं ये जानना चाह रहा था कि जो भी जो आप टास्क फोर्स आप करेगी इसमें मेथोडोलॉजी और सर्वे सैंपल क्या होने वाला है क्या ये सभी बच्चों के साथ आप इंटरेक्शन करने वाले हैं या फिर आपने कुछ सैंपल सोच के रखा है कि इतने इस सेगमेंट में हम लोग सैंपल रखें
आपका प्रश्न ये था कि सभी बच्चों से कर रहे हैं सर्वे। देखिए हमारा जो टास्क फोर्स जो सेटअप किया गया जो बनाया गया है हायर एजुकेशनल इंस्टीट्यूशंस के लिए और ये हायर एजुकेशनल इंस्टीट्यूशंस को हम टारगेट कर रहे हैं। तो इसका मतलब है जो कॉलेजेस में और मेडिकल इंस्टीट्यूशंस है और प्रोफेशनल इंस्टीट्यूशंस है और यूनिवर्सिटीज हैं primarily उनके लिए targeted है because we are looking at the incidence of suicides and attempts to suicides in those institutions, and there could be larger phenomena, but we cannot, it's too big a task, and this itself is large enough for us. जो हमने सर्वे वगैरह किया है वो उसको नज़र में रख के किया है जो हमने डिज़ाइन किया।
if any member wants to add anything, please go ahead.
Anyone wants to add? Yeah.
Professor Seema, you want to add?
जैसे सर ने बताया वो basically it is limited to higher education institutes, number one, and it's not limited to any one kind of higher education institute. So we are trying to get perspectives from both central state universities, in institutes of national importance, and all other institutes which fall within this rubric. That's number one. Number two, in terms of sampling, while the survey goes live, that is why you all are here, that we are, requesting and appealing as many students as possible from diverse backgrounds to be able to attempt the survey which is made available. But then that will of course depends on the level of participation, and that's why we want to generate this public awareness about it. In addition to that, we will be, as I think Armanji and others were mentioning, we will try to capture perspectives from different stakeholders through stakeholder consultations in the field visits that we do, which will obviously be the extent to which that is feasible across regions from diverse colleges and universities with in those regions where we visit, and perhaps open spaces where we are able to capture diversity. So this is how we see that it is feasible within the time frame, and of course we would be able to comment upon that once we are able to generate responses as to how far we have been successful, and we do request your support for the same. Thank you.
Thank you for that question. Yes, please.
Uh, Hi, I'm Akshay Thakur from the Tribune newspaper. Mike, I just want a clarification. Recently, 2 weeks ago, Supreme Court has also released a set of guidelines on the mental health. So once the NTF report will be out, will this supersede the Supreme Court's report? Or which one will be fine?
No, we are aware of the recent judgment of the Supreme Court, which has set out 15 guidelines. Now, that's something which we will definitely factor in. It'll be included. It'll be a large part of what the operative part could be. But we are studying the phenomenon, which means that we are looking at the actual facts, and then we are seeing institutionally what exists. क्या है reality में जो people encounter in terms of the infrastructure, number of counselors, what are the stress points. So this will be complementary. Nothing will supersede. As we see it, we are not either. We can't think of our task resulting in something which will supersede. We will keep that into account and see how that can be worked out, keeping the facts that we gather, in our mind.
Yes, please.
Hello everyone, I'm Sanket Kaul from sorry, from Business Standard. Armanji mentioned about an interim report by the end of September. So just wanted a clarification on when can we expect a report to come from the task force, and also would it include suggestions or recommendations, or would it just be what's happening or what the current situation is in terms of mental health in students who are studying in higher education institutions?
I don't think we will be able to give any suggestions because we are still in the process of studying the phenomena and we don't have complete data. We have not got the responses from the concerned audience which we are looking at. So it would not be a complete report. So therefore, whatever interim report would be on the lines of reporting to the court as to what is the progress that we have achieved in this last 4 months, the methodology we're going to adopt, and so on and so forth.
This is Gunjan Sharma from PTI. How the task force is going to take into account students specifically from higher education institutions and medical institutions. But as a media professional, we see that the large number of students USITEs that we see come from coaching institutes as well. And while some of these students are school students, some of these are in middle of, like, they have already passed out from school and are ready to enter the higher education space. Is the Will the task force also look into the aspect of student suicides by the students who are coaching students?
Uh, See, our task is essentially to look into higher educational institutions. We are into the fact that students in the school level and even in these coaching institutes in all these places, they are also undergoing the similar phenomena. But then, looking at the limited nature of our remit, we are presently going into that. As of now, we have not firmed up any opinion about how to go about in these other institutions, but certainly not below, higher educational institutions, because that is our remit.
Thank you. Any other question?
Yes.
Just wanted to also add that in our questionnaires, especially the students' questionnaire, we also are trying to understand the coaching access, where the students access coaching, and what was the nature of distress they may have experienced. So these are all retrospective questions that we've asked to understand their college pathway, the pathway that they have traversed to come to college. So we have some questions there.
Anyone else who wishes to ask a question, you may please identify yourself by raising a hand so that the mic can be passed to you. Those who have asked, if they wish to ask a second time, you are most welcome. Okay. So with that, I think then we can close the open forum. And coming to the conclusion of today's press meet, it can't be done without expression of gratitude. So I request Dr. Nidhi to please come and propose a vote of thanks.
Thank you, Dr. Aksa. Honorable members of the press, distinguished guests, and colleagues, as we conclude this significant press meet announcing the launch of our comprehensive website and multiple surveys, as you've seen, the initiative that we have taken on behalf of the National Task Force constituted by the Supreme Court of India, I would like to extend our heartfelt gratitude to all of you, the press, who have made this momentous occasion possible. First and foremost, we thank the esteemed journalists and media representatives present here today. Your vital role in spreading awareness about our website will ensure that our surveys reach the students, faculty, parents, mental health service providers, and institutions across the nation. Your extensive media reach will encourage these groups to actively participate by providing valuable information on multifactorial causes of mental health concerns and, most importantly, sharing effective solutions. We express our sincere appreciation to the National Informatics Center for their exceptional technical expertise and dedication in developing this robust digital platform. Thank you. Their professional expertise has transformed our vision into a user friendly reality that will serve thousands of students and parents and faculty across the country. Our deepest gratitude goes to the representatives from the ex officio members from different ministries, and most importantly, the Ministry of Education, the Department of Higher Education, whose pivotal role as convener has provided invaluable guidance and facilitation throughout this initiative. So thank you very much. Their institutional support has been essential in making this project a reality. We extend our sincere appreciation to the state nodal officers across the country whose ground level coordination and support will be crucial in implementing this initiative effectively in their respective regions. We extend our thanks to Kaushal Bhawan for graciously hosting this important press meet and providing the perfect venue for this announcement. We are grateful to our sign language interpreters for that this important message reaches all members of a community, making today's announcement truly inclusive and accessible. We also acknowledge the collective effort of all task force members whose dedication and expertise have shaped this comprehensive initiative to address student mental health concerns and provide effective solutions. Thank you all for being part of this transformative journey. Thank you. Over to you.
Thank you so much, Dr. Nidhi. And I want to remind that the press brief for today's press meet is available online on the website. You can also download it from the QR codes which are present in the hard copies of the press brief in English and Hindi. It's also on the YouTube channel of Ministry of Education on which the press meet has been live streamed. Thank you so much, and we look forward to meeting you again. Uh, may I request everyone to please rise for a group photo?
Hello everyone. There is a question from a journalist who has joined us online. So the Hindustan Times has asked, please name the 6 institutions that the task force visited as a part of its work and what were the discussions held there.
Uh, the task force, the task force plans to visit many institutions. It has before this launch of this website too, uh, visited some, but then it's too preliminary, so we are not in a position to share that information because it's premature and we can't draw conclusions. We can't see patterns. So I think it would be better that we get a fuller picture after the entire survey and all the institutions are visited. So it's not a there should be no reflection on any institution. So that we would not like to share that information at the moment. But going forward, our report will certainly do.
Thank you so much. I think now we can have the group photo. Thank you so much. And the tea and refreshments are outside the hall. May I request the support team members, our research assistants, NIC team who have worked on the website, and all the members of the Department of Higher Education to please join us for group photos, because it's all collective effort and we all should be together on stage.